this really quickly. Perfect. This is Luann Fortune. I'm with Jenny Dudecker, and we are doing a self-massage workshop here. We've covered the introduction and ground rules, and we're going to jump right in and give instruction and ask you to follow along. So these are the instructions for the neck and the shoulder and the back, and I'm going to take down the screen right now, and I'd invite you to follow along with me. I am actually going to turn on speaker view for myself, and you might want to do that too, so you have a better view of me. So I think I might have to spotlight myself, huh? There we go. Good. So can everybody see me right now? Good. So the very first thing is you've set up your space. You've taken yourself into a private room or turned off your phone or asked your kids to just hang out for the next hour while you take care of yourself. And later on, you might even want to share some of these strokes with your family and the people who you're around, because they can be applied and converted to others. But we're going to start with ourselves right now. So you've set up your space. I have some candles going. I'd invite you to do that. You might want to have music in the background, but whatever is comfortable for you. The next thing I'd ask you to do is to center yourself. So many of us have a tradition around that. You might want to just start with a deep breath in and let your eyes go partially closed. And give yourself a couple moments to set aside all the places you've come from and the places you're going to be going to next. And allow yourself to focus in on your breathing. And give yourself permission to care for you for the time we're together. And if you find yourself called away or distracted, bring yourself back to the present moment through your breathing, paying attention to your breath in and your breath out. Then I'd invite you to make contact. So we're going to be using our hands today. We're going to be using our whole bodies too. So you might want to start with rubbing your hands together, making them warm. And then I'm going to place my hands in my lap for a second while I focus on my neck. So bring your mind's eye, your attention to your neck, and gently nod your head back and forth. Yes and no. Side to side at your own pace. Noticing what you're feeling. Don't go too far. And go at your own speed as you begin to loosen up and stretch your neck, because stretching is also part of massage. Breathing in, breathing out. You might want to rotate your head around your neck. Very gently, one direction and the other direction. Breathe in and breathe out. You might want to let your chin drop toward your chest, gazing down toward your navel, opening up the space in the back of your neck, letting the vertebrae open up and breathe. Ever so gently, you can bring your head up to neutral. You might want to very carefully put your chin up toward the sky, toward the ceiling, stretching out the front of your neck ever so gently. Breathing in and breathing out. And now take your mind's eye, your attention, if your eyes are closed or if you know where you are because you're near a mirror or window, you can begin to shrug your shoulders and bring your shoulders up toward your ears and then let them go down. Relaxing, releasing, along with your breath. Bringing your shoulders up again toward your ears and letting them fall down. One more time. Up and then down. And then you might want to give them a little roll, rolling your shoulders backward a few times. And sometimes people ask, do we count strokes? No, you just do what feels right for your body in this moment in time. But you might want to reverse too, rolling forward, breathing in and out. I invite you to let your shoulders rest. And now take your attention back to your hands again. And this might be another time for you to rub your hands together. Your hands will be the instrument of your next stroke, because you're going to take the flats of your hands and you're going to place them either side of your neck with the fingertips at the base of your skull. And using the flat of your hands, very gently stretch away from the midline. And then do it again. And while you do that, you might find that your hands, the flat of your hands, begin to float down toward where your neck meets your shoulder. And if that happens, bring them back up again toward that ridge at the base of your skull. And do it again. Now, you don't want to go too far forward here. The general idea is not to go past about where your ears would create a plumb line if they could reach down to your shoulders. So you're working the back, stretching out your neck, remembering to breathe. And you might notice what feels tight. Where do you want to go back to later when you have the luxury of all day long to stretch out your neck? From the midline to the outer boundaries. And now I invite you to take your fingertips and place them at that ridge that's at the back of your neck, at the base of your skull. And you can see here in my mirror, I'll use one hand and you can see where I am working from. So I'm taking my fingertips and I'm massaging the ridge area at the base of my skull. That's called the occiput or the occipital ridge. It's a very important point for body workers as well as for our bodies. I'm going to bring both hands back right now. You might even find that you can lean your head back toward your fingers a little bit so your fingers don't have to do all the work. Your head can create a little bit of pressure too. And I'm making circles and gradually moving out a little bit so I can cover the area right up onto the bony ridge behind my ear. We call that the mastoid process, for those of you who like to know anatomy. You might feel you can reach some of your fingers almost underneath the ridge, and you might want to go slower. And if you can see what Jenny's doing, she is mirroring me, but she's doing it in her own way. This is a great place to massage on most people. And in a second, I'll tell you about a self-massage tool. You can use it to get to this area. But now I'd invite you to take your hands down and allow yourself to stroke with the flat of your hands the side of your neck to your shoulders. We're going to visit the shoulders next. Oh, and I don't know about you, but this is where I feel a lot of tightness. So, without straining my hands or my own arms, I'm just going to let my gravity do the work as I pull down the side of my neck toward my shoulders. And then when I get my hands down to my shoulders, I'm going to use the flats of my hands to stroke and then to knead. So with my hands on the same side, I'm going to knead using my fingers and my palm, squeezing and kneading to the outer shoulder joint as far as I can comfortably go. And you'll probably find that you can't go very far, so you don't want to strain and stretch your reach. Oh, let yourself sigh out if that feels right to you. Now, what you'll notice is that if I stop here and I put my hands down and reach across to the other side, one shoulder at a time, I invite you to continue the kneading on one side, all the way down, and I can reach behind, as you can see on the other side, all the way to where my shoulder blade reaches up. And I can use my fingertips to even dig in a little bit. This muscle is called the trapezius, and it probably keeps our hands and our fingers up on our keyboard all day long for us. And it gets very tight, and we don't give it enough chance to release down and relax. So this is a great place to massage. I invite you to come back to do that later in the day, maybe in between sessions or while you're in one of your sessions, to take just a quick moment to massage across those shoulders, all the way down to my shoulder joint. Then I'm going to take my flat of hands on the same side of my torso, and I'm going to reach all the way down. I don't know if you can see me here. Uh-oh. Reaching down. Reaching down that way. You can't completely see me. Let me see if I can stretch out a little bit. I'm reaching down toward my waist with the flat of my hands. And I can also take my hands and reach behind me. And I'm reaching down from about where mid-waist would be, maybe a little higher. And I'm using the flats of my hands to reach down and around. Now, when you get your fingers down toward your pelvis, you can use those fingertips to make little circles along the back of your pelvis. And I think I have a couple minutes to show you this, so I am going to change my angle so you can see me a little bit better into the mirror. There we go. That's it. I'm going down with my hands. And then when I get toward my pelvis, making circles down around there. Be sure to breathe. I know we could spend probably a lot more time there, but I'm going to end this portion with a hug. So take your hands across your body, your arms across, and give yourself one hug here, breathing in, breathing out. When you do that, you might feel you can stretch in between those shoulder blades and those scapula. And while you're doing that, I'm going to show you a tool that I've come up with. It's a pretty famous tool. It's very high tech. It's 2 tennis balls in a sock. Some of you might know about this. So you can probably find these materials around your house. And the 2 tennis balls go into the sock and the sock gets tied. Now, what am I going to do with that? Well, remember that spot at the base of your neck? Well, imagine putting your tennis balls right over there and lying on a floor and letting the tennis balls roll up and down from one side to the other. You could even roll the tennis balls all the way down your back, lying on the floor and letting yourself press into them. Now, that might not sound like it's the easiest thing to do, so you can do that standing up. And you can bring yourself on over to a wall or a door. You put your tennis balls right back. I'm sorry, you can't see the back of me. And now I'm rolling up and down across my tennis balls. This is a great tool, and some of you may know a lot about how to use tennis balls like this. There are lots of tools that are sold for this purpose. And let's say I'm done with that part. I can remove my tennis balls by holding on to the end of my sock. So we can talk more about how to create that. There is a handout on that in the materials that we've distributed to you. So you can go ahead and use it. Maybe someday we'll have a class just on using the tennis balls, because you can use them on your hands, your arms, your feet, and all different parts of your body. So if you're still hugging yourself, I invite you to take another deep breath in now. And let go of your hug. And you can gently brush off your arms. And we're going to go on to the hands now. So Jenny, are you ready?
I am. Yes, thank you. And I'm not sure, do I need to highlight? Okay, you've spotlighted me. Perfect. Thank you. All right, so now that we're already feeling this deep relaxation coming down from the top of our body, we'll continue moving down into our hands. And as you can see already, we've been using our hands to create the touch on the body. And now this time we get to actually offer that relaxing and deep nourishing touch from one hand to the other. So we'll start by just bringing hands together, again, warming them up a little bit after that nice big bear hug that we gave ourselves. And then simply hold your hands together in your lap. So I'll drop mine down off camera and resting in my lap just for a moment. At this point, if you do want to use a lotion or an oil or cream, you can. Again, like Luann was saying, a little goes a long way. So maybe just 1 or 2 drops in a carrier oil, or one maybe the size of a pea, or maybe how much toothpaste you would use. Put that on your hand. So Luann is demonstrating a little bit of lotion. I'll do mine dry so you can see that option as well. I have removed my ring so that I don't run into anything. So if you want to take a quick moment and take jewelry off, that can be helpful. So we'll start by simply holding our hands one in the other, and we'll use our thumb to gently press and start to spread the palm. So as we're pressing in, you might start to already feel, oh my goodness, I didn't know that I was tender there. Right? Our hands are on call almost all the time. And so now we're giving our hand the opportunity to sit back and relax. So we're just gently spreading. From here, we'll move from one finger at a time. We can wrap fingers around the base of the finger, or you can use just first finger and thumb. And we're gonna do just really gentle circles here with each finger. And as you move out from knuckle to fingernail, give just a little bit of a squeeze. So do what feels right for you. We don't have to squeeze really hard here. We're enjoying a little bit of a twirl or a twist, and we're gonna move all the way out from thumb to nail bed, and maybe even all the way out to the point. So also, if you are familiar with Chinese medicine and the meridians, all of the meridians have points right at the tips of the fingers, entry and exit points. And so really giving yourself a little bit of time and space to get all the way out to the tip of the finger. Moving through the thumb as well. Again, you can kind of change positions of how you're holding your hand. Sometimes things can get awkward if we try to stay all twisted up. So just allow yourself to find something that feels normal and natural. From here, we will glide a couple options to work the top of the hand. You can simply press the fingers from knuckles down towards wrist. So we can move in this direction. If you are sitting out in front, maybe resting your hand on your leg, you can pull back this way. So we're bringing our attention to that space between bones. So we're in the space between those metacarpals, those bones of the hand. Giving yourself a little bit of time to make sure we get through all 5 digits. From here, we will interlace the fingers together, turn them to face out, and gently press out. So we're opening the palm, spreading the palm, giving those fingers a bit of a chance to stretch. And then as we roll the fingers back in, we're in perfect placement to start using the thumb to create little circles in the nice fleshy part of the hand. So as we move through here, I know that texting has taken over in our form of communication, and that's really can be very hard on the thumbs. So go ahead and give yourself time to press into the thumb. Maybe even take that hand and grip behind so that we can allow that movement to come to the other side, working the base below that pinky finger. And you can take this and work in a clockwise or counterclockwise motion around the hand, getting up to the knuckles, the inside of those knuckles, working all the way around the pad of the hand. I'm sure that you'll notice once you get in here some places deep in the hand that might grab your attention of, oh, wow, I didn't know that I was sore there. So really honor yourself in that and give yourself a little moment to get into those places that really feel that they're calling toward you. So there's no real right or wrong way to do this. The hand is a very forgiving place. So as far as safety goes, follow what feels right for you. Going into the nice squishy places is probably where you'll find the most benefit. So from here, we'll move up to the wrist. We can wrap our hand around the wrist and kind of knead in one direction. As Luann had mentioned, our hands do a lot of work, and sometimes if we can let our body do the work, so she had her head rest into the hands, that's an option here too. So we can kind of gently grip and then actually move the hand, or the wrist, rather than that massage hand. And we can allow that to come all the way up the arm. Another option here is to simply place the fingers on the wrist and just pull up towards the elbow. And we can kind of do that going all the way around the arm, working the forearm. This part of the body takes a hit with being on the computer so much, especially the flexors and extensors, grabbing onto that wrist and working all the way up towards the elbow. Making your way to the elbow, we want to be gentle with the joint. We can roll our fingers around the elbow. Again, you can use that kneading motion down here as well. And then continue offering that gentle touch all the way up the arm. Going from both sides, both directions, coming all the way up to meet where we were working before with top down. Also allowing this movement to come into the armpits, especially for women. Great to be able to give a little bit of movement through the lymph. We have lots of lymph nodes that come in through the axillary area. So giving yourself a little bit of attention as we come down the side of the body. And from here, we'll let our hands rest back in our lap. Notice just for one long breath, if you can tell a difference between the left and right sides of the body. Maybe the hand that you just worked on is feeling a little bit more alive, maybe even a little bit tingly. And we'll allow these strokes to now come to the other side. We want to do both sides of the body. So again, we'll start by simply holding the hand and then placing the thumb on the inside as we spread the fingers. Gently spread those fingers out. Opening up the hand. And then we'll start at the base. It doesn't matter if you start with pinky or thumb, just maybe starting at one end so you can keep track of where you were with those gentle twists, maybe even offering a little bit of a pull of the finger as we come all the way to the end. Get that nail bed, the sides of the nail, and then moving on to the second. So again, you can find times like this where we can really let the receiving hand do the motion, and then we're just kind of gripping with the working hand. So lots of options here. Let both sides of the body work together. Moving through all of the fingers. Again, just a little bit of pressure, a little bit of a twist, all the way out to the tip of the nail, and working the thumb. Gliding across the tops of the hands, getting in between those metacarpals, in between those bones, coming all the way down. Luann's offering, if you can see her screen too, again, just letting this be organic. So there are different ways to do this. We just want to think about giving that contact in between the space, between the bones. From here, we'll interlace fingers, turn them to press out, open through the palms. That stretch comes all the way up through the carpal tunnel, through the lower arm, upper arm, and then we'll return back. Again, we have a great location now to be able just to drop that thumb right into the belly of the other thumb. And we can change position of how we're holding so that we can get all the way up through those inside of the knuckles, through those really yummy, fleshy parts of the hand, and come on down the side of the pinky finger. Again, taking note of what feels really great for you. If this is bothering your working hand, you can use knuckles. Okay, so there are ways to do this. You can also just create a knuckle. This is one that I'll do while I'm in a workshop if I have the camera off, and then just rest my hand on the knuckle and just roll my hand around. So this is the contact I'm making, but I'm not really using any force from my working hand. It's just holding a knuckle. So lots of options and fun tools here. Play with it, see what works best for you. We'll move up the wrist. Again, a little bit of a squeeze and a knead going in both directions. Coming all the way up the forearm. Remembering those flexors and extensors from being on the computer, typing all day, writing your dissertation. Get in there and move those muscles around a little bit. Coming up into the elbow. Again, we want to just be gentle, especially with the inside of the elbow. So we'll do a little bit of a rotation around the joint, coming all the way up the arm. We don't want to forget about the armpit, right? Bringing nourishment through the axillary area all the way down. We were working side body with Luann, so we can make that contact again. And then as we come into closing, we can start up at the top. So we're connecting what we just were working on with what we just finished, head, neck, and shoulders. And we can just brush the hand all the way down the arm. Take it from neck, long stroke, all the way down the arm. And then let the hands rest in the lap. We'll take a long inhale and exhale here. And just notice how those hands are feeling resting in your lap. Again, maybe a little bit of movement, maybe a little bit of oxygenated blood going through there, feeling a warmth. And from here, we'll take our hands down to our feet. So I will pass it back over to Luann, and we will work with the feet.
Thank you, Jenny. Spotlight myself. So now I'm going to reposition my camera, and it's a little bit of a camera check here too. This is a good place for me to get my baby wipes out, or my face wipes, or whatever they happen to be. And I'm going to do a little bit of foot hygiene, first of all, because my foot has been very busy already this morning. And how's that position? Is that good?
That's good, Luann, there, that tilt that you just did.
Okay, I think we can, now I'm going to do a little foot wiping first of all to get started. So I've got a nice wipe, nice clean hands, and then when I was practicing some of our strokes here, you know what I think I'm going to do? I'm going to drop down a little bit. Here we go. I think that'll be a better view. I think that's better.
Yeah, that's better.
So I've also got a little towel because in case you want to use oil, if you're going to use a couple drops of oil, you just put a couple drops onto your hands and rub your hands together. What you don't want to do is you don't want to go pouring your oil all over your foot or any other body part that you're going to be working. And then first of all, I'm going to start very gently just by holding my foot and noticing temperature, texture, dryness, warmth, coolness, and just bringing my touch, my own healing touch, my own energetic touch to my feet that they do so much work for me and they're so important to my whole body health. And then I'm going to use both hands with one hand on top and one on the other to warm up my foot. Gently stroking up from the heel, stroking down from the toes back to the heel, noticing any particular areas of dryness, tenderness. The feet are so important to us. Not only do they support us, our mobility, our movement, but they're also responsible for our balance, both actually and also in a holistic, whole body kind of way. So now that I've got this foot warmed up and ready to receive, I'm going to begin spreading. So with my thumbs on the bottom and my fingertips on the top, I'm going to move my thumbs up starting at the heel and spread across the pad, the bottom of my foot. And please remember to breathe in and release out. I can also use the flat of my thumbs to spread the bottom of my foot out this way. And while you're doing this, if you find you have to readjust, maybe you have to move your foot around a little bit, maybe move your body around a little bit, maybe you want to alternate your hands a little bit. And I'm starting to get in there deeper and doing some kneading. And then my toes are calling out to me, so I'm going to take each toe, and you can see Jenny also following along. And I'm going to do gentle little toe twists, starting with one side. And you can start with the big toe or you can start with the baby toe. But as Jenny pointed out, it's very helpful to remember which toe you got. So I'm now working one toe and then going to the next. And when I do this, the toes, unlike the fingers, are made for stability and not as much dexterity. So I might not do as much rotating with them, but I can still pull out all the way to the tip. Like the fingers, each little toe has 3 bones in it, 3 joints, except for the big toe. So when you get to the big toe, depending on how big your big toe is, you might want to use a different hand. You might want to use more fingers to spread out the toe. Breathing in. And then I also like to get to the base. I like to put my fingertips down toward the base of my toes and push in ever so gently. And then something I like to do that you might have learned in yoga classes, sometimes I like to give my toes a handshake by working my fingers in between my toes all the way in, similar to what we did with the hands and the fingers. Oh, and greeting my toes like they were old friends. Now, if you find that your toes don't work that way, that's okay, but you might want to take one finger at a time to get in between your toes and stretch them out. So in my practice work as a massage therapist, one of the things I saw as people aged is that their feet became less mobile. They became less flexible. And with that, so became less flexible their mobility. The toes are an important part. You might want to even stretch them down and stretch them out. Ah. And then one thing from here I do is I take my hands and put them across the top of my foot. So I'm cradling my foot, exposing the bottom side. And then I'm going to work the bottom of my foot with little thumb presses all the way across. Some of you might have heard about an art science called foot reflexology that says that there's a point on the bottom of our foot for every one of the places in our body. And while that's certainly true from a balance standpoint, this idea says that it also relates to our organs. And in fact, in our handout, we've provided for you a chart, a foot reflexology chart, that can show you where those points are. And you can see that using my thumbs, my foot resting in my lap, I'm moving all the way down to the heel. Now, what I might find, and you might find, is that there's a particular point that might be tender and sore. For example, this spot, right for me, is a little bit tender. It's the place of the adrenal glands. The adrenal glands are connected to stress, as some of you might know, and I like to go back then and give that a little bit extra attention. And be sure to breathe in and breathe out. If you're really interested in foot reflexology, something I found is a foot reflexology socks. You can probably find them on the internet, and they show you where the points are on each one of your feet because the points are different for you to press into. Also, one of the benefits of our online virtual experience is that sometimes when I'm in a class or a meeting, I'll bring my foot into my lap and I'll start to work the reflexology points. Oh, but that's enough for right now. I'm going to take this all the way up to my ankles, and using my fingers on one side, my thumbs on the other, I'm going to make circles around the ankles. It's a place where a lot of lymph collects. Also, place lymph collects is on the top, just like we work the tops of our hands. You might want to take just some time to work up from the toes toward the ankles, between those metatarsals. This is a great place to work if your feet are retaining water or swelling. And then when you get up to the ankle, you want to do some ankle rotation, and you can take your foot like a runner's rotation, runner's stretch, and rotate your foot around the ankle, one side, one direction, then the other. And then I finish off with a little bit of ringing, with my hands positioned together flat and then moving opposite direction all the way up to my heel, and then some tapping at the very end to enliven my foot. This is excellent stroke for any of your clients, friends, family, or self who experience any neuropathy. That would be tingling in the feet, tingling or numbness, and brushing it off to finish it up. I'm going to repeat that on the other side. I'm going to move a little bit faster, and I'll let you and invite you to work at your own pace. I think I'll move my screen. There we go. So here we have the other foot. It's also dry, so I'm going to take a couple drops of oil. And I'm going to warm up my foot, first holding it, noticing temperature, then spreading it. And I'm going to go faster on this side. Toes one at a time. Be sure to breathe in, getting to the big toe. Pressing down into the base of the toes. If you have children, by the way, especially if you have young children or young grandchildren or other young people in your lives who are just learning to walk, pressing right at this place, at the base of the toes, is an excellent place to help them develop arch support. It works for grown-ups too. When I was full-time in practice world, one of my specializations was working with babies in perinatal work. Yes, babies need massage too. And they also like foot reflexology. So I'm going to press now using my thumbs into the base and then across the other way. According to foot reflexology, this is the place of my lungs. I'm moving down toward my diaphragm. Because I'm on my left side now, I'm going a little bit further and reaching down toward where my liver point is. And then down across my small intestine. There's that adrenal gland point once again. Moving downward all the way to my heel. All the while, be sure to breathe. And you might take note of places that you want to go back to later. And now I'm going to make some circles with my ankles, on my ankles with my fingers and my thumbs, supporting different ways that your hands work. You might even want to just use the flat of your hands. You might want to be able to use your thumbs and your fingers on opposite sides. And then you might want to take your foot and rotate it around your leg, around your ankle, one direction, then the other. Oh, and then I want to be sure to get the top of my foot too. So I'm going to use my fingertips to trace down the top of my foot toward my ankle bone. And here we're going to finish off with a little bit of ringing. All the way to the heel, and then tapping. And then brushing the foot off and the lower leg. And I'm going to come back to my foot. I'm going to hold it ever so gently. And now I can notice, what is the difference? How do I feel in this foot as it caught up to the other foot that I massaged earlier? And at this point, the rest of my body is beginning to call out. Tell it, yes, I'll get to you. I have something in store for you. Take a moment here, though, with your foot before you say goodbye to it. Breathing in. Release out. And something you may have noticed through all of this is that even your beautiful fingers and handwork aren't what release the muscle. That, as we know, the muscle releases the muscle. And what you've done here is you've given it time and space to do that. But now I'm going to say goodbye to this foot. I'm going to reposition myself and my camera, and we're going to move to something, a very quick version of Abhyanga, which is a self-massage practice based on an Indian tradition, India-Asia tradition, of massaging the body every day. So I'm in front of you now, as much as the camera will let me, and I invite you to take your hands and to rub them together. And we're going to do brushing for the rest of our body. And it's going to happen pretty quickly. So start with one hand on the arm, opposite arm, and brush downward. Brushing outward from your arm, your shoulder, all those areas that we've already covered, down through your hands. Breathing in, across your shoulders, across your neck, across the back of your scapula, and then allow that hand to rest. And then the other side, taking your other hand, brushing down the fingertips, brushing from the neck, brushing across the chest, using both hands to brush across, and then rest. Oh, and then brushing down the sides. Oh, and then an area we didn't get around the belly. Might want to brush around the belly too, and around the back. Brushing out. And now one leg at a time, use your entire hands to brush out the thigh. And then I'm going to reach down and down through my leg, out through my foot. Breathe. And the other side, brushing up the other leg. Down through the lower leg. And out through the foot that we massaged earlier. Hands in the rest place. Breathe. Oh, and what about our neck? Brushing out. And something we haven't done, very gently, you might want to put your fingers to your head and give yourself a little bit of a scalp massage. Thank you, Jenny, for following along with me. And you can press into different parts on your head as well. And even though in these COVID times we're told not to be touching our face, if your hands are clean, the face is a wonderful place to open up your sinuses, your breathing, all your sensations. But today I'll ask you, invite you to rub your hands together And when they're warm, gently place them across your eyes, fingertips resting on your forehead, and you can allow your head to gently fall into your hands. Breathing in and breathing out. Might just take a second here. Take a moment. You might notice where in your body you want to return to later. You also might want to express some gratitude to yourself, mostly, for taking this time. Self-care. And take another deep breath and very gradually move your head into a neutral position. And when you're ready, you can open your eyes if they were closed. And you can join me again, because I see we're at the end of our time together. So Jenny, anything you want to add in the minute we have left?
I want to thank everybody so much for being willing to explore self-massage with Luann and myself. And please listen to your body, like Luann said, coming maybe something that wants a little bit more attention later this afternoon. So just deep gratitude. Thank you.
So the last thing I'd like to share is a quote from one of my favorite poems by Nikki Giovanni. And in my house, she wrote, "And if ever I touched a life, I hope that life knows that I know that touching was and still is and will always be the true revolution." Thank you for being here. I will be happy to stay on if anyone has questions, but I know that many of you have places to go next. So we hope we'll have a recording. We have a recording from a previous session, and you can always contact us, L. Fortune at Saybrook and Jenny DeDecker, J. DeDecker at Saybrook. We also provided some references for you in the handouts, but if you have further questions, get in touch, and you can always find me at Mindful Moments on Monday, Wednesday, Friday at 9:15 Pacific time. Thank you all for being here.